Patients who are admitted to ICU are really unwell and they often require mechanical ventilation. These patients are often subject to lots of bed rest, which can lead to pressure injuries and lung infections. So our job as physios is to get these patients moving as early as we can to prevent these complications. It can be difficult though to decide when it's safe to exercise these patients. The risk of an adverse event happening can be high because they're so unwell. So that's the problem at the moment. It can be quite hard to decide when to exercise these patients. Hi, my name's Jemima. I'm a physiotherapist at the Prince Charles Hospital. My research aims to look at early safe exercise in patients in the intensive care unit. Recently, some guidelines were developed by ICU experts to help us decide when to exercise ventilated patients, but these guidelines haven't been validated in an ICU setting before. So my research aims to validate these guidelines. By doing this, we might be able to begin to exercise our patients at an earlier stage, preventing those complications such as lung infections or pressure injuries. If exercise begins at an earlier stage, perhaps our patients could get out of ICU earlier and potentially get home earlier as well. Another part of my research is looking at when it can be safe to exercise patients who have had heart surgery and need a little bit of extra medication to support their heart in the post-operative phase. Normally we are getting these patients up who are requiring the extra medication to support their heart, but we don't have an idea about what that's actually doing to their hemodynamic system. But through using this equipment, we can get a greater understanding of what is happening to their heart, and this might be able to define the safety profile for exercising these patients. And this will be fed back to the wider physiotherapy community. Success in this project to me is seeing our patients getting up safely, getting out of bed safely, in a happy, supportive environment. It would be great to have people support my project to hopefully learn how we can exercise our patients earlier and potentially get them home earlier too.